try my best to be contained. I think my primary sort of interest in the conversation is, from my vantage point, the suicide prevention angle of this conversation is a graduate. It's like the master's degree, and there's a bachelor's degree, which is a robust conversation about mental health, and then there's school years, and we're kind of at the pre-K level in terms of the public discourse, and so. What I'm trying to do is develop an arc, and this is what I did with Alif Elan, is that we started with out-of-school children. People are still stuck on that. People think that's all we talked about because we really had to establish the norm that every child has to be in school. So the norm in this case with mental health, if I'm looking at it from a long-term conversational arc for the country and for our society, is that it is okay, nay, it is critical that we reduce the stigma around talking about mental health. That really is the primary principle, big picture call to action from this conversation. The problem is that, as Danica just mentioned, there's a number of complexities that enter the fray as soon as we declare it safe to talk about mental health. Really courageous and brave individuals like and families like Aisha's will enter the fray and say, okay, here I am, I'm ready to talk about it. And that will then trigger, because we're dealing with an unhealthy society from a mental health perspective, it will trigger responses that potentially will exacerbate rather than enable conversations or problems. So, for example, is it a good idea to try to suppress video evidence of an incident because it may serve as a trigger for people and, the kind of copycat syndrome? Or is it more important to publicize the conversation because at least you have an entry point for the conversation? And I'm not sure there's a right answer to that or a wrong answer, but I think that the task of mental health professionals writ large, the 500 psychiatrists that we have, is really complicated by the competing incentives in how we talk about stuff and how much we talk about stuff and who's talking about it. The digital domain and the wider broadcast media, but especially the digital domain, I think are triggers and drivers for mental health issues that we're not talking about. There's not a lot of digital literacy, if you will, or digital intelligence, even in adults. So a lot of digital behaviors probably are unhelpful to people's own mental health, but also are unhelpful to other people who may be vulnerable to the exacerbation of stresses or anxieties that are quote unquote normal. I mean, if you have something that affects 50 to 70 million people, that's not a, it's not a, there's nothing unique about that experience. There are some key risks in terms of talking about this more and provoking or pushing for greater fiscal allocations and a more robust national conversation that'll lead to a mental health policy for the nation. Some of those risks, and they're again very difficult to grapple with, out of the 500 psychiatrists, how many are at risk themselves? And what is the risk of malign actors within the mental health professional community? And from a malign actor perspective, there's a number of questions about potential emotional and sexual abuse, ranging to privacy concerns. If you're in the, I mean, it's one thing if you're in the public domain, but one of the core areas of risk for me, again, from a, because I assess or analyze national security and foreign relations, I think Pakistani diplomats and Pakistani soldiers, especially in the last 12 years, have by and large, 95% of them, this is my own number, I'm just making it up, suffer from PTSD. There's no way they can't, because I've been in the rooms where we've dealt with crises, where we have soldiers talking about stuff, we have diplomacy professionals or foreign policy professionals. I mean, these people deal with stresses that are very, very difficult for an ordinary person to kind of come to terms with in terms of the stakes that they're dealing with. We've had a battlefield war going on for the better part of a decade and a half. Who is taking care of the mental health of the soldiers that have survived that war? And who's taking care of the mental health of the perpetrators of those crimes? Violent extremists are also human beings. And in terms of their rehabilitation, what is the process by which we might need all 500 of you just to deal with that category of people? So I don't mind, I don't mean to problematize or deepen the kind of, because all of these issues may lead people like me. I'm a very risk averse person. My first principle is do no harm. So if you're going to talk about something and it'll make it worse, don't talk about it. That's like rule number one for me personally. I know it's probably a consideration for others. Um, Finally, one of the constraints to talking about particularly suicide and mental health, this is my last point, Danica, thank you, is the language that we associate with mental health. So, there was a moment when on married women, there was a knowing smile that was exchanged between three of us. Actually, if there's a person in the room who is in a marriage that is leading to thoughts of suicide, those smiles could be triggers for. So, and so you get really self-conscious as to, are we allowed to actually share a joke or a laugh about stuff? And we've seen with the kind, I shouldn't call it feminist, but the Me Too sort of movement or moment, that the language has itself become a political minefield. So the word sad, right, is a big problem in depression, because it technically it's not sad, it's depression, it's a clinical condition. And then the other word that was used was drama. I mean, that's something, because I'm an emotional guy, and I always have been. As a child, I've been, very expressive and impulsive, and I continue to be. And I'm lucky that I have the self-esteem to be able to absorb lots of accusations of dramatics, But I think if you haven't been as lucky as I am, and especially if you're female, from your childhood on, the word drama and the impact of that word on people's psyche, I think is incredible. So the question on language is, do we shut down people and become a language police and therefore probably repress the conversation, or do we allow, or are we more tolerant of these words in the wider conversation, because at least it allows us an entry point for the conversation? And again, I don't think there's a clear-cut answer to these, but these are challenges for the mental health community to guide people like me on as to how to engage. And until I do, it'll be very difficult for me to engage publicly